Welcome to the Crystal Methamphetamine e-learning series, brought to you by St. Stephen's Community House. In this video, we'll learn a little bit more about the project and about the 4 modules that make up the learning series.
There are 4 separate e-learning modules. Each one is about 15 minutes long. Part 1 is an introduction to crystal methamphetamine. Part 2 will help you understand the impact of stigma on users of crystal meth. Part 3 will help you to understand some specific challenges associated with crystal meth and the do's and don'ts of working with users of crystal meth. Part 4 offers tips and strategies that come from evidence and direct experience for de-escalation of challenging situations. It is designed for frontline workers in drop-ins, shelters, transitional housing, public health, mental health agencies, corrections, and any program or services that use a harm reduction approach. This also has value for managers of such programs and services in terms of informing the development of service standards and policies.
So who are you listening to? We are Jordan, Radha, and Casey. Jordan is a peer worker at St. Stephen's. He has lived experience as a user of crystal methamphetamine. Casey is an Australian social worker who has worked in the AOD sector in Australia and in addiction supports in Toronto for nearly 8 years. Casey was the crystal methamphetamine project coordinator at St. Stephen's Community House. Radha is a social worker and has worked for 25 years in the nonprofit sector. Together, they will guide you through the content in the modules. We encourage you to go through all 4 modules from start to finish to get the full benefit of the information. However, each module is designed to stand alone and be viewed separately, so you can get a deeper dive into each topic area. All the content is evidence-based and informed by lived experience, drawing from peer-reviewed research and our combined experiences. Each module contains reflection questions, tips, exercises, and scenarios to help make this an interesting learning experience. We encourage you to view all 4 modules for more holistic learning. These modules are brought to you by St. Stephen's Community House's Urban Health and Homelessness Services Department, specifically their crystal methamphetamine project. Creating opportunities and strengthening communities has been St. Stephen's motivating force for over 50 years. We work with individuals and communities primarily in downtown Toronto to identify, prevent, and alleviate social and economic problems by developing and delivering a range of highly effective and innovative programs. Our Urban Health and Homelessness Services Department promotes the health and well-being of individuals living with substance use and mental health issues by challenging stigma, advocating for change, and providing responsive community programming. All our programs are voluntary and client-centered. We use a harm reduction and trauma-informed approach. Specifically, the Crystal Methamphetamine Project offered interim case management support built from our well-established integrated model of care. The focus was to connect individuals with longer-term intensive case management, coordinated care planning, and active support from primary health. We are grateful to the Toronto Central LHIN and University Health Network for funding this project.